Fleet Phospho-soda Solution is a laxative medication used to empty the bowel before certain medical procedures or surgeries. It is also used to treat occasional constipation in some cases. Fleet Phospho-soda Solution contains sodium phosphate dibasic and soda phosphate monobasic as the active substances. These are saline laxatives that works by drawing water into the bowel, softening the stool and promoting bowel movements. Indications: Fleet Phospho-soda Solution is indicated for colon cleansing prior to colonoscopy, barium enema, or other bowel procedures. It is also used for the relief of occasional constipation when recommended by a healthcare professional. How to use: Fleet Phospho-soda Solution is for oral use. The dosage and administration method may vary depending on the specific medical procedure or constipation relief required. Follow the instructions provided by a healthcare professional. Typically, for bowel cleansing before a procedure, the recommended total dosage is 1 bottle, 45 ml of Fleet Phospho-soda Solution mixed with 120 ml of cold water, followed by an additional 120 ml of clear liquids after each bowel movement. The solution is usually taken in divided doses on the day before the procedure. For occasional constipation, the dosage should be as directed by a healthcare professional. Contraindications: Fleet Phospho-soda Solution is not suitable for individuals with certain medical conditions, including severe kidney disease, heart failure, or electrolyte imbalances. Avoid using Fleet Phospho-soda Solution if you are allergic to any of the ingredients. Special instructions: ensure you follow the specific instructions given by a healthcare professional for your procedure or constipation relief. Drink plenty of clear liquids while using Fleet Phospho-soda Solution to prevent dehydration. Side effects: common side effects of Fleet Phospho-soda Solution may include bloating, stomach cramps, and nausea. In rare cases, Fleet Phospho-soda Solution may cause more severe side effects such as dehydration, electrolyte imbalances, or kidney problems. If you experienced any severe or unusual side effects, seek medical attention promptly.